everyone, this is Regine Peñalosa from group number 6, and our topic for today's video is all about labor, birth, and lactation. So before we proceed with our discussion, let us identify our objectives first. So first is explain the processes involved in lactation and assess the advantages and disadvantages of breast and bottle feeding. The second one is to describe the process of birth. Discuss and compare the different birthing methods. Describe how labor and delivery are initiated and controlled. Explain the positive feedback mechanism that occurs during labor. And the last one is to describe how newborn's condition is assessed at birth or in a new birth screening. So in order for us to make this video more organized, I'll be the one to explain the process involved in lactation and assess the advantages and disadvantages of breast and bottle feeding, while my co-members will also explain the rest of the objectives. So let us define what lactation is. Lactation is the process of producing and releasing milk from the mammary glands in your breast. It begins in pregnancy when hormonal changes signals the mammary glands to make milk in preparation for the birth of your baby. Feeding your baby directly from your breast is called breastfeeding, or sometimes called as chest feeding or nursing. It's also possible to induce lactation without having pregnancy or without being pregnant, using the same hormones that your body makes during pregnancy. Lactation also ends once your body stops producing milk. You can also feed your baby milk that you have expressed or pumped from your breast and save it in a bottle. So we might be wondering how lactation works in our body. Lactation involves expressing the milk through your nipple. When there is a stimulation from infant sucking, or pumping with the breast pump or hand expressing, the nerve signals the brain to release milk. And when we produce milk, there is a hormone that is responsible in creating this, and it is called prolactin and oxytocin. Prolactin causes the alveoli to make milk, and oxytocin causes muscle contractions that push out of the alveoli and through the milk ducts. According to Pamela Wiggins, breastfeeding is a mother's gift to herself, her baby, and the earth. Breastfeeding is the most natural way to feed your baby. Your body was created as the ideal way to supply your child with the perfect source of nutrition. There are also many good reasons to breastfeed your baby, but there are also disadvantages to nursing as well. Understanding the pros and cons of breastfeeding can help you decide what is right for you and your family. Breastfeeding has a lot of advantages in the baby's health and to the body of a mother as well. But in this video, we will be discussing the primary ones, the factors that we can use in our future in order to choose what is really right for us and for the health of our baby. So, breast milk is the only best natural food designed for your baby that protects from any infections and diseases. The nutrients in breast milk are unmatched by any other first food your baby can receive. Unlike formula, breast milk is soft on your child's body. It has just the right amount of nutrients for infants, proving to be great for brain growth and nervous system development, especially for premature babies. Nutrients found in breast milk includes fat, protein, sodium, calcium, and iron. Breastfeeding can also boost the immune system of a baby. Breast milk is a strong illness-inhibiting food. The anti-infective properties strengthen the immune system to prevent harmful bacterial growth. Mother's milk directly protects against mild to severe infections, preventing hospitalizations of a baby. It also works against the other conditions, including digestive, respiratory, and ear infections. Breast milk is easily digestible as well. A mother's milk is perfect for babies developing digestive tract. Your child is able to break down breast milk better than formula and use less energy doing so. In saving this energy, your child can then use it to get rid of any components he or she might have difficulty in digesting. The nature of breast milk is gentle, easily absorbed, and well suited for your baby's system. This gives your child more fuel for better body function and development. Breastfeeding can bring benefits to the body of the mother as well. All the benefits aren't just for the baby. Mothers can receive many health benefits as well. While breastfeeding, your body burns calories, which can help you lose the weight you gained during pregnancy. Additionally, breastfeeding lowers your risk of developing breast and ovarian cancers as well as diabetes later in life. It may also decrease your chances of developing rheumatoid arthritis or diabetes, hypertension, and cardiovascular diseases as you age. Aside from all of this, breastfeeding is also convenient and economical. A mother's breasts are the perfect way to supply the baby with optimal nutrition at the perfect temperature. There is no need to worry about preparing and heating formula, and there aren't any bottles to clean up after feedings. It also helps in keeping your child healthier, which can lower medical costs and reduce the amount of work you miss to care for a baby during sickness. While breastfeeding, it also serves as a delay of your period. And when there is a delay in your period or menstruation, it can also serve as a natural birth control. Breastfeeding can prevent your period from returning for 3 to 6 months or even longer. Typically, menstruation returns approximately 1 month after you stop breastfeeding exclusively. Among all of the advantages that I have just mentioned earlier, there are also other benefits in breastfeeding. While there are many advantages to breastfeed your baby, it is not for everyone as well because there are also women that doesn't suit with breastfeeding. So here are some reasons women choose not to nurse or not to breastfeed their baby. The first thing that we can get as a disadvantage of breastfeeding is that it requires healthy lifestyle choices. You have to think about your diet and lifestyle if you breastfeed because your baby may have a reaction to different foods in your diet. So you may have to stop eating dairy products or other items that you enjoy. There are also some substances that should be enjoyed in moderation, like caffeine and alcohol. These can be harmful to your baby. Stress and other factors can also affect breastfeeding and even decrease your milk supply. The next thing is that there can be discomfort involved with breastfeeding. When you first start breastfeeding, you may experience sore nipples. For the entirety of your breastfeeding endeavors, your breast may feel swollen or engorged. Feeding a baby in public may also be more difficult. While public acceptance of breastfeeding is improving, there are still some situations that you need to cover yourself while breastfeeding despite how hot it is outdoors due to embarrassing moments. The other one is that everything you consume is being passed on to your baby. Any food you eat, Medication you use, or anything that you are applying to your skin can and most likely will be passed on to your baby through breastfeeding. The other disadvantages of breastfeeding is that you need special clothing and bras in order to breastfeed comfortably. Your baby will also start sprouting teeth at some point, which can be very painful for you to experience. The shape and appearance of your breast can change as well. While this doesn't happen to all women, most women reports that their nipple becomes larger and it changes in colors, and some women experiences sagging breasts earlier when they breastfeed with their babies. You can also measure how much milk your baby is consuming since you just feed them through your breast. Some babies need more milk than others, and while some need less. Unless you're pumping the milk and measuring it with a bottle, then you can measure how much milk they consume. But if you just feed them through your breast, it could be difficult for you to measure the milk consume that your baby has. You also have less freedom in breastfeeding because when you breastfeed, you are always on call. You and your breast needs to be available for every feeding day and night. It can be exhausting, especially during the first few weeks when you will be breastfeeding your baby every 2 to 3 hours around the clock. You may also leak at times that are inconvenient or embarrassing for you because when the baby cries, you almost immediately start producing milk. If you aren't prepared for this properly, it can be inconvenient and embarrassing for you because you will really see in your nipples that the milk is leaking. So we already have discussed the advantages and disadvantages as well as the process involved in lactation and breastfeeding. Let us now move forward with the bottle feeding. So bottle feeding is the alternative way of feeding your baby, and it is also a substitute for breastfeeding. Although the formula provides all of the nutrients a baby needs to grow and thrive, there are also the advantage and disadvantages to choosing to feed a baby with formula or with bottle feeding. These considerations extend not only to the baby but to the mother as well. So let us discuss first the advantages that we can have in bottle feeding. The first one is that anyone can feed the baby. So there is a shared care among the two parents, the mother and father, towards the baby. One of the benefits of bottle feeding is that either parent can feed the baby. Feeding is an important bonding moment. Breastfeeding doesn't give the daddy an opportunity to bond with the baby. Bottle feeding allows the siblings, father, and other family members to spend some time with the newborn baby. It can also be done in public, which is very convenient for you or for us soon to be parents. Some moms are not comfortable with breastfeeding their babies in public. If you don't want to expose your breast or go to a private area just to breastfeed, bottle feeding is the best way in order for them to have milk even if you are in public. Keeping a track of your baby's intake is easy as well. So the measuring intake of the milk of the baby is very easy because it isn't easy to know how much milk your baby is drinking when you breastfeed. While bottle feeding, it helps you find out your baby's daily milk intake. You don't have to worry about as well with your breast milk supply if it will be low or it is too much because many moms worry that their baby will remain underfed if their breast milk supply is insufficient or not enough. In such cases, many parents resort to bottle feeding. because this ensures that your baby gets all the milk he or she needs to grow and develop. However, because of this, baby does not suck on their breast, which leads to a lack of milk supply if they try to breastfeed. That is why if they try to bottle feed, they do not need to worry about their milk supply. The next one is that you don't have to worry about making changes to your diet. A mother who feeds formula or using bottle feeding to her baby, it doesn't or he doesn't, I mean, she doesn't have to worry about adding specific fruits and veggies to her diet because she can eat and drink anything she likes. And bottle feeding helps babies who have intolerance as well. In rare cases, infants cannot process breast milk or animal milk in their body. This situation is known as lactose intolerance. Then, the suitable milk for them is the formula milk, such as soy protein, can be fed from a bottle. And the last one is that the mother's health condition doesn't affect the baby. If the mother falls ill or if they get sick after childbirth or they faces health issues that don't let them breastfeed, a bottle can be used to feed the baby, which is very convenient for them so that they can still feed the baby even if they cannot breastfeed. We already know that bottle feeding is a common alternative way for breast milk or breastfeeding, but still it doesn't come without disadvantages. A mother should carefully weigh the advantage and disadvantages that comes with formula feeding in order to ensure that their babies are getting the enough nutrients that they need. The first disadvantage of bottle feeding is that it lacks nutrients and prone to bacteria. There are studies that infants should be given breast milk in the first 6 months since they were born because formula milk do not have natural nutrients that are needed to have healthier babies and more improved immune system of infants. Apart from the possible allergies that babies can get, mishandling of the formula milk and poor preparation of feeding bottles can accumulate bacteria and it contaminate water which can lead to infections and diseases. The next one is that preparing the milk for bottle feeding takes time and effort, which is very time consuming and is inconvenient in some part. You can breastfeed your baby on demand, but if you have habituated your baby to bottle feed or in bottle feeding, you need to wash and sterilize the bottle, pour milk into bottle and warm it. It's a lot of work, so improper sterilization can also put your infant's health at risk. So, it is truly a disadvantage of bottle feeding because you really need to take care in terms of the preparation of the bottles and the formula milk. The other disadvantage of breastfeeding is that it can be expensive. If you choose to bottle feed formula milk to your little one, you will need to buy feeding bottles, a cleaning brush, and also a sterilizer. You'll also have to invest in a good quality breast pump or formula milk powder. All this can be added expense to your monthly budget, which is very expensive since you really need to ensure that these materials are good for your baby. The other disadvantage of bottle feeding is that bottle feeding may compromise your baby's immune system, which is very crucial in some situations. Study shows that breast milk develops and improves your baby's immune system, while formula milk, on the other hand, it doesn't contain vital and natural nutrients. Formula feed babies also carry the risk of developing certain illnesses like a chest infection, ear infection, urine infection, or diarrhea. It also affects the mother and baby bonding. Feeding is a bonding moment for the mother and her baby. When the baby latches onto the mother's breast, skin to skin contact is established. While bottle feeding may hamper this bonding, which can really affect the relationship or the bonding time of the mother and the baby. The last one and the most disadvantage of bottle feeding is that it is really inconvenient. You really need to clean these bottles, these bottle feeding bottles, and formula milk, baby nipples, and other necessities if you try to travel. It can be troublesome to manage the things as well as the baby at the same time. Bottle feeding is also inconvenient if your baby requires midnight feeding sessions as you have to get up and prepare the milk each time if you want them to feed them with milk that is just prepared ahead of time, or that if you want them to eat or feed the hot one. So that will be all for the bottle feeding advantages and disadvantages. If we try to compare these two methods of feeding, we can really identify and determine what really suits best for us and for our baby's health. So it is really important to weigh things out before deciding what feeding options or what feeding methods we will use in order to feed our baby, because the health of our baby lies on how we treat them and how we prepare their food for them. So that will be all for my topic. I hope you learned something in this video. Let's now hear from our next reporter. Thank you for listening.